What is it that case managers do? And here are a few responses.
I want to say a little bit about case managers. They know everything. They know everything before anybody else does. They are amazing. They're educators, they're coordinators, they really coordinate care for all of our patients and families, and they are really, really good at bossing us around and getting us to do what we need to do to take care of our patients.
As a pediatric hospitalist, I engage daily with our case managers on all 4 of the medical surgical units. In working together, we try to prepare our patients and their families for a safe, easy discharge. What I love about the case management group and what they do, their job, is that they really help identify obstacles and barriers to a safe and easy discharge by meeting with the families, by meeting with the providers to talk about the patients and to discuss what the family needs in order to safely transition a patient to home. I know the families can't do it without them, and we certainly can't, so you're much appreciated here at Hopkins.
Case managers do so much. They are such an important part of the healthcare team as we take care of ever more complex patients. They're uniquely suited to have the medical background, knowledge of administration, utilization management, and healthcare needs of our patients to make sure that they get the best care in the most efficient way possible.
What do I think of case management, or what's case management's role? I really think of case management as sort of the glue of the team. You hold us together. I know that if there's ever a question about a patient or we need to know anything about the patient, the case manager always has the answer and is the place to go. You're also the taskmasters, and so if the case manager comes to me or comes to one of my therapists and says, you need to do this now, we know we need to do this now. And so those are really important skills, and we really value your role.
I'm proud to sing the praises of case management this afternoon. We represent about 40% of all the patients that come through the Department of Medicine, and we rely on our case managers to help provide each of these patients a safe discharge. It's remarkable, and in fact unimaginable sometimes, how complicated some of our patients' situations are. And the case manager's knowledge, their unique skill, their ability to communicate effectively with all members of the team and all members of the family, and to understand what resources are available outside of this hospital is exactly what we need for each of our patients, again, to give them the safest possible discharge from Johns Hopkins.
Well, when I think about what case managers do, what I know about this topic is what I've learned from Amy Deutschendorf. And she has taught me that what they do is really a bit of a team sport. That is to say, the case managers are the quarterbacks, but they're overseeing the assurance that there is multidisciplinary approach to the maximization of the care process in the hospital. So we're talking about looking at the episode of care in hospital, trying to use an evidence-based approach. We're assessing at the front end of the episode of care, and then we're monitoring with the idea of making sure that we include patient and family in the process, that we are concerned about making certain that there is adequate education, that we are caring for any transitions that are being anticipated. And it's really an approach that has become more standardized thanks to largely to Amy's oversight. And so I'm very pleased with what I've seen over the last couple of years, and now what happens in hospital, of course, is being coordinated more broadly across the continuum.